Whether you're a parent navigating myofunctional disorders or simply curious about optimizing your family's overall health, the Myohacker Podcast is your guide. Hi, I'm Karindy and Dr, a speech-language pathologist, myofunctional therapist, and a mom on a mission to bring holistic health to you and your family. Together, we'll explore whole-body connections and integrative solutions. Please subscribe and leave us a 5-star review to help other families discover this important information. Visit myohackerslp.com for free resources and guides. Quick disclaimer. The content shared in this podcast is for information and entertainment purposes only. The views and opinions expressed by the host and guests do not necessarily reflect those of the podcast or its affiliates. This podcast does not provide medical, legal, or professional advice. Always consult a professional regarding your circumstances. By listening, you agree that the host and podcast are not responsible for any actions you may take based on the information provided. Now, let's dive into today's episode. Welcome, everyone, to the Myohacker Podcast. With us today is an incredible dentist and author, Dr. Shereen Lim. Would you mind telling everyone a little bit about you, where you're located, because it is a big time difference between the two of us, and what you do?
Yeah, I'm a general dentist from Perth in Western Australia. And about 14 years ago, I became very interested in sleep and airway health. My husband's snoring was driving me pretty crazy, and I decided to research about dental sleep appliances, or the mandibular advancement devices that can help reposition the lower jaw forward during sleep to help stop snoring. And I decided I wanted to learn more about that to help other spouses in the same frustrating boat. So during the course of that, I understood that there was some research to show that palate expansion in young children could help improve obstructive sleep apnea. And I thought to myself, how come we're using Band-Aid solutions to compensate for poor jaw development in adults? Why don't we help grow the jaws earlier in childhood? Because that's what we're taught we can do during our dental training. But the reality is a lot of people, when we refer to an orthodontist for an early interceptive evaluation, the patients are told to wait and just wait. So they come every year, they don't get any interception, and I didn't want that for my own children. So that's when I decided that I was going to learn more about palate expansion and interceptive orthodontics. And then I came to understand that the root causes of poor jaw development is oral dysfunction. So how can we address the poor muscle habits that promote poor jaw development in the earliest years of life? So that's what I now focus on, less on adults and more on tongue-time management and early interceptive orthodontics.
Yes. And guys, if you want, you can go, and I encourage you, you want to do this. Please go read her book. Let me make sure I get the subtitle right. So it is Breathe, Sleep, Thrive. Discover how airway health can unlock your child's greater health, learning, and potential. So if any of that resonated and you have questions, get the book. We're going to talk about some things here today, but I want you to have that as an amazing reference. So before we were recording, we actually we're talking about things that are kind of juicy. So let's jump into talking about lower lip and cheek ties. Tell us about this and this amazing post you had on Instagram. I wanted us to talk about that and the images you showed about a case and how it led you to kind of be a detective and think about patterns you were seeing in these lower lip and cheek tie cases.
Yeah, I mean, the last year or maybe even this last 7 months has been really one of lots of new discovery for me. I really started with paying more attention to lower lip tie. So I had a patient that was due for an upper lip tie and a tongue tie, and I looked at the lower lip and I'm like, wow, this is really tight, a lot of strain in her chin. And I said to the patient, we could consider releasing this. It's really tight. It's not something that I do a lot of. And she asked me, is that why when I puff air into my lower lip, I can't puff air into my lower lip? And I said, oh, yeah, maybe. So we did it. She could puff air. And what I realized is I started testing it on a few different people, and I saw, wow, there's a correlation between the depth of the mentalis crease, or the crease under the lower lip and chin, and the degree of tension in the frenulum, the lower lip frenulum. And when I looked at it, it just gave me a simple way to assess the tightness of it. So it's just something that I just started looking in every patient. And then I started to do a few more. So, for instance, when I saw lower crowding in a child's mouth or a very recessed chin, I started to offer that a little bit for patients that I'd already done other releases on. And what I noticed in the children and adults that I was doing it on, many of them were telling me their shoulders dropped in the chair.
Wow.
And they were having this profound relaxation of chin tension. I've had like a couple of adults tell me that they've been able to get off anti-anxiety medication just through the relief of this tension.
What?
So whenever I see this...
Wait, just the lower lip tie release?
Yes,
That's amazing.
They attribute it to that because there's so much tension. Like one of the adults told me she didn't realize it was tense until after I did it. And then she realized, wow, all her life she felt like a giant man had his hands and fingers intertwined around like her shoulders, scapula, and her neck, and that had gone. And so I started to realize, wow, this tension, it's associated with this mentalis strain and maybe lower dental crowding. And then I had like an adult told me her lower jaw could come more forward easily. She could close her mouth better and reposition her lower jaw forward. And that made it easier to close her lips around it. So I just started to notice all these. And then I looked at it in babies because I was getting quite significant improvements in my adult patients and my children that parents were telling me how impactful it was. So I started doing it on infants as well. And what I realize is that we think that we don't need a lot of people call it the special K flange, where the lips are fully extended around the breast.
Yeah.
People think it's not super important. As long as we're getting weight gain or good not having pain, they think that's okay. But ideally, what we want to do is we want to have that good deep flange, and we need to pay attention to that lower lip.
I mean, because if somebody has, a profound letdown, you don't have to really have any kind of latch. You can and still show that you're gaining weight, but this doesn't mean we're actually encouraging craniofacial development and growth. So I love that you're looking at, no, we do need this flange. We do need this, to actually be expressing that development of the mandible, of the craniofacial, just the whole system, that movement.
Now I can look at a baby and I can just see, okay, there's a big head here under the lower lip. Wow, that cannot flange. And it's quite common. It's more common in my tongue-tied babies. It's quite a common finding.
I mean, I've seen it where adults are biting it. And I've had to advocate, like, can we get this released? And often we kind of receive this like, well, that doesn't happen. And then I have to be like, but look, it's happening. They're biting it. Like, this isn't comfortable. And that, yes, okay, they do have an overbite, but I mean, I even wonder how much that's contributing to this adult overbite.
I think form follows function.
Right.
And we all pay attention to the tongue. We think that the tongue is so important for palate development and providing the expansile forces across the palate. But if we understand those inward pressures or the tension can actually restrain normal development as well. So this lower lip tie can actually restrain that mandibular translation and that forward growth of the mandible. But then I started looking at the cheeks shortly after.
This is the one. This is the post, guys. Go back and look at her Instagram post. It got me thinking lots.
When you do adult, like most commonly, I'd never really looked at them. I share a lot of orthodontic posts where we have the cheek retractors and we look at the teeth and people are going, what are you going to do with those cheek ties? And for years and years, I've been like, well, they're not cheek ties because you cannot diagnose ties on photos. But I was like, we're stretching open these cheeks. Of course, there's going to be some tension, but we don't normally need to do that in real life. So we cannot necessarily call it a tie. But then when I started to notice, okay, we're doing these cheek tie releases on adults that have gingival recession. Their gums are exposing the roots of their teeth because of this tension. And then I'd watch adults after the cheek tie release, and then they would move their mouth around, and you could just see how free their mouth was and that reduction of tension. And many of them were saying, oh, my smile is bigger, it's looser, everything is loose. They don't get food stuck in there anymore. It's just easier to wrap their tongue around and clean out their food. And it just occurred to me, wow, these cheek ties are actually really pulling in the cheeks and they're creating this restriction of that development. So I just realized if we could get rid of some of that tension, maybe the face will grow better. So I started to look at my orthodontic patients and look for cheek ties. And what are some of the red flags I realized is if we have a V-shaped arch. So if we have a V-shaped arch, that could be an indication of increased cheek pressures. Also, sometimes if the teeth are tilted inwards, so we have instead of the teeth going straight up and down, they're actually tilting inwards. That could be a sign as well. Or even if there's just a very narrow gutter palate, it's not just about the tongue not being able to provide those expansive forces. And it's not just about overuse of the cheeks because the tongue's not working. There's a pattern of dysfunction depending on where the other areas of tightness are. So if we have those cheek ties, we will have more inward activity of those cheeks. And so now I think when we have a narrow, high arch palate, it's not just the tongue. It's really these cheek ties and the inward pressures. So what I started to look at is my orthodontic patients. You know, when we start to take the orthodontic patients out of the retainers, they don't always go back to normal. But I'm looking at the lean of the teeth and how they actually tilt back. You get this subtle tilting back of the teeth. They want to go back to where they were if we don't address those cheek ties. And sometimes you can see if one tie is tighter than the other side, the tilt is more on that side as well. And I'll just look at things like their face when they smile. If the lifts on one side more than the other and we see more gum on one side, you know, I think that side is more tight. I'll predict that side is more tight. And I start looking at these things. So now I can look at faces because pretty much when I do the cheek tie releases, everyone will say their cheeks they're just not as pinched. They look more soft there and their smile is looser and wider. So now I'm very convinced that these cheek ties, if unaddressed, are a really important contributor to poor facial development. And orthodontic relapse, no matter how well we address the tongue.
And there's so much strain. Well, I love this because I'll see the strain like on the eyes.
Yes.
With, you know, you can see how much it is pulling. And I do fascia work myself in my practice, but I also refer to body workers, to chiropractors. And, you know, it's so often we're talking about this. Are you feeling that tension? What are you seeing? And especially in babies, you know, we see this pattern and it's pretty wild when you'll see like, okay, releasing these buccal ties or cheek ties and then the hip flexors open. And now we have just more range of movement in the torso, in the cranium, like everything starts moving. Even people will report like hearing changes, which is just wild because you think of that strain, that pulling.
Absolutely. And Karindy, ever since I've introduced these on top of the upper lip and tongue ties, I feel like there's just more immediate feedback regarding the face and regarding the body shifts as well. Yesterday, I saw this baby who looked like he had a permanent frown and just now looks like a different face baby. But one of the things that I wanted to mention about cheek ties is as well, I've had 5 patients that I've released the cheeks and they have had profound improvements in nasal breathing in the chair. And even one of these patients, she is an adult patient who had palate expansion surgery. She had double jaw surgery. She still was unhappy. She felt she couldn't breathe through her nose. So she went back to her home country. She had radio frequency, reduction of the turbinates, and she still wasn't happy. And then we did all these other releases because when I saw her 4 years ago and sent her for the surgeries, I was looking only at the tongue. But when she came back, I realized, wow, she has all these other ties around her whole mouth. So that is why her mouth and face has grown so small. But she had that profound improvement in her nasal breathing with the cheek tie releases, having gone through all those surgeries, which I think she needed to have those structural changes. So I think that's been really interesting because obviously this tension, it is limiting her flow through her nose and sinuses. And the other night I was watching, I'm not sure if you're familiar with her because I discovered her from that night, is Heidi Widoff. She's a myofunctional therapist. I think she's based in Florida. Anyway,
I probably follow her and I probably love her stuff. And I'm just like, oh, I don't know her name.
She'd be very interesting. So she was presenting on the same topics, lower lip ties, I think was it low, and the cheek and upper lip ties, and
Right.
how that can improve nasal and sinus airflow, and hypothesizing about it, and how she's been guiding some of her providers to release a little bit more thoroughly to get those improvements, and how
Mm,
she combines it with facial massage.
right.
So it's fascinating to hear someone else is seeing those things and, helping with the facial massage. And I think there's a lot that we need to learn about this area.
Absolutely. I mean,
Yeah.
there's so much when we can get more blood flow with just fascial manipulation,
Yeah.
even the laser therapies, different
Yeah.
things that we can do that changes it. But ultimately, if you have a fascial restriction,
Mhm.
that's where you need it released. And
Mhm.
I have a lot of people that I work with and collaborate with, and people that interact with me online that really hold firm to thinking if you do enough body work, if you move enough, like,
Mhm.
you don't need to release anything.
Mhm.
This will take care of itself. What
Mhm.
are your thoughts when you hear that? When people say, like, I just need to be moving more, doing different things. We didn't have restrictions, years ago. Why are we having all of these? What do you say when people say it's not a thing?
Yeah, I think you can always try to do non-invasive options to start
Right.
with, but there comes a point where people shouldn't have to have, for instance, chiropractic treatment like every month or, to deal with it and then to have it return again as
Mm-hmm.
well.
Yeah.
For me, I think if I see it and feel it and the patient has had ongoing body work, there comes a point where it can be good to make a decision regarding this,
Yes.
especially in young children, because it's compensations. And if we can kind of break those habits, we can get things to work and function and therefore
Mm,
grow better as well.
absolutely. So I'm just thinking, even with the upper versus lower lip ties, or
Mhm.
and cheek ties, like the
Mhm.
buccal ties. What are some of these behavioral shifts? Just thinking about those tension patterns, like what
Mhm.
people present with. Because how many people are listening right now that are like, I had my upper lip and I had my upper cheek ties
Mhm.
released, but I didn't even think to look at lower. And we have a local provider who is now releasing them very regularly, the
Mhm.
lowers, in
Mhm.
in the really infants and everyone that's seen him, and they're beautiful releases. It's coming
Mhm.
out beautifully. So what are maybe some things that people should listen for or pay attention to in their body if they're like,
Mhm.
I've already done releases, but I haven't done the lowers? What
Yeah.
might take them back into the office to get reassessed? But
Yeah. So what are the things to look for a lower lip tie with a baby? Sometimes when you look at the babies and you look at maybe the lower lip looks a bit more enlarged or two-toned.
there we go.
Uh,
Okay.
do you know what I mean by that?
Yeah, yeah.
Yeah.
Almost like a
Um,
blanching, and then like it looks like
yeah.
they've got some coloration and then not. Yeah.
Yeah. And then they're very deep crease here.
Yeah.
If you see a very deep crease here, have a pull and check the tension of the string, the frenulum.
Right. Are you
And
seeing
but that,
wrinkle reduction in older patients? Like, I'm just thinking
yes.
myself. I'm like, let's go in. Let's go,
Yeah, people
let's
that think
reduce
they need
these.
Botox for their ventalis
Yeah.
strain, it can actually release a lot of that. And this, I think I mean, it sounds crazy, but I think it gives people a sense of well-being to have this if they have that
Yeah.
tight ventalis strain.
Yeah.
Yeah, so they're the things, and I take videos now. Like if I have a baby, because I always have taken face photos, checking the facial tension. Now I'm taking a little video, even if it's only a couple of seconds. So
Yeah.
it's more dynamic and I can actually see how the baby is resting and when they swallow. Like sometimes if they have a lower lip tuck, when they swallow, that whole tension goes across
Yeah.
their whole lower jaw. So seeing that all release.
Mm. And it's just so crazy because I think of like myofunctional training,
Hmm.
we really, and I think there's so much to it. Like,
Hmm.
we're taught that we're seeing this mentalis strain
Hmm.
because the tongue is not, it's like disorganized in getting, the bolus or the liquid at midline, and like you had said, that compressive force. And so I think there's just so much for us to be really paying attention to of, sure, it can be that mentalis strain as a result of, like you'd said, the tongue and dysfunctional swallow, but we do need to just be looking at, is it because of that tie? So I'm sure
Yeah.
we're going to have different measurements. Are you working on any? Like how to measure? Because, we now have different
Yeah.
tools and measurements for all of the ties.
Yeah. Not
What do
at
you
the
think?
moment, but I have I'm taking extra videos, extra photos. I'm just trying to
Okay.
document everything. I'm nerding out. I study all these quite well. Mental strain, we know from that 6 red flags from Dr. Zaki, that is one of the top red flags that
Right.
a child is not breathing or sleeping well during sleep. So I
Mhm.
always used to think that it's just because the lips are not good at sealing. The child has
Right.
to compensate to close their lips. So I thought it was a sign of poor lip seal, but really with all those patients, I encourage people to really pull out the lower lip and see how much tension and how much you're having to fight that chin.
Mm.
And, we may actually find that it is actually related to lower lip tie. And
Wow.
then when it's released, I feel like patients can close their mouth around things like munchie, habit
Yeah.
correctors, just without
So
strain. Yeah.
that's a huge one. Like, sometimes with the Myo Munchie, I'll be like, oh, we need to sort of adapt it or shift it if they're running into that, or I'll flip it upside down, because you have that little
Mm-hmm.
arch in it that's more made for
Yes.
the upper
Yes.
tie, but it's like
Yeah.
sometimes we need to shift it because the lower is getting in the
Yes.
way.
Yeah.
And, we've just kind of worked around it. So
Yeah.
I actually like thinking like, well, maybe we don't have to anymore. So I do want to talk about that
Yeah.
case that you mentioned.
Yes.
So you had seen this pattern. They came in, they'd already done some expansion. Is that correct?
Yeah. What you were referring to the case where sometimes children have really small mouths,
Mm-hmm.
and it doesn't allow for all their teeth to fit in.
Right.
And so I posted that on a day where I had my third child that had a small lower jaw and severe dental crowding that was blocking out one canine. So a whole tooth was not fitting into the jaw.
Right.
And then I really discovered in those 3 patients, there was a lower cheek tie on that side.
Mm-hmm.
And I've now seen 5 patients with blocked out canines on one side. So I realized
Wow.
that if we have a blocked out canine on one side, it's because there's a crowding situation where that jaw hasn't developed well on that side. And now, in a short space of time since paying attention to it, I've seen 5 kids with this problem, and there's one cheek tie that's tight. So it just really strengthens my hypothesis that these cheek ties are actually contributing to tension, which is restraining the normal development of the jaw.
I'm so excited. Okay, I just think this is gonna blow things wide open.
Yeah, thanks for letting me talk about it, because it's really difficult to unsee these things.
Yeah.
I see babies and then I'll see them when they're 7 years old,
Right.
and I can look at what I missed, and then I'll see the children that I've done orthodontics, and I'll see them a few years later just to check how things are going and seeing which ones are less stable than the others. So I get to see all these things that I've been missing.
Right.
And so
Isn't that the worst?
and I have so much documentation, photos, videos of speech and
Yeah.
everything, that I can learn so much that I feel I have a lot of insight that I want to help other people to look for as well.
Hmm. I think it'll be interesting for us to be watching for like other things that kind of go along
Mm-hmm.
with these
Mm-hmm.
lower ties. I'm just even thinking, okay, rib flare, like what are we seeing and how they're breathing, how they're compensating just because of that tension? Even like, are we seeing pitch changes in voice as, because you don't have that pulling on the hyoid, the larynx can chill out a little bit and drop. And so I just think it'll be fun for us to see some of these shifts and changes.
Yeah, I would encourage you. Like, I was speaking with my lactation consultant last night. I'm like, you need to take videos of the latch before and
Yeah.
after, because I take videos of everything, but I don't get to observe the latch. But like yourself, take videos of the eating before and after, the speaking before and after, and then we've just got so much that we can study and work out. It'd be really interesting
Absolutely.
to hear from other professionals.
Okay, so guys, that's the call to action for this one. We're going to talk about a few more things, but that's the
Yeah.
call to action, everybody, is the lower ties. Let's take a look at them. Do you prefer to expand first or release tethered oral tissues later? Like, what's your progression? What's your timeline with things in an ideal
Yes.
world?
Yes, my favorite age, if a patient does not have too many functional issues is to expand around age 5.5 to 6 years, well before the permanent teeth come in. I actually really do love to see the teeth come through in better bone rather than come through crowded, which is more difficult to fix. So timing wise, do I do the releases first or not? The most part, I actually prefer to do expansion first. Yeah. With expansion, for me, generally speaking, a round of expansion is about 9 weeks long. And it's very predictable in terms of you turn a key, it widens, and then we're remodeling that bone and we're getting those quick improvements in the palate vaults as well as breathing and sleep. So it's a really quick way to get it start, and then we can make more room for the tongue. We've got that better nasal airflow. Whereas to do the releases, it's a lot more compliance based. We have to do myofunctional therapy. I feel like people can drop out of that more easily. And then we haven't even made a proper impact yet. And so I feel it also gives me the option to develop better rapport with the children so that we're doing the release a little bit later when they're more and more comfortable with the practice. But I would say that if it's a small amount of expansion that I'm requiring, it's not as much, maybe I would shift to doing the releases first. Because then I know a more stable environment. Yeah.
I just love for people, because I get that question all the time, and I think we need to hear it. I mean, I think it's so often based on function, like if it's affecting things. I don't know if you do this, but I work with providers that will even do like staged releases where sometimes, we'll be like that. I'll see this in older kids, not so much in a baby, but in older kids or adults. And it's like that they are tied right there. I mean, they can't really even lift the tip. And so we might do it a little bit of a release. And I say a little bit, but it's because we weren't able to really functionally lift the tongue enough to do a lot of the exercises we like to do to get that nice deep release. So in those cases, what are your thoughts on those? I've had dentists that I've referred to before and they're like, I've never heard of that. What are you talking about?
Yeah. I mean, yes, sometimes I think we need to do a 2-phase tongue tie release if it's particularly restrictive. The first one just to get more mobility, and then to do a more thorough one after better myofunctional therapy. But actually, what I have seen as well is I've seen people do really good myofunctional therapy with a restriction that, maybe it's not so urgent. Maybe we could do a round of expansion quickly, just make your tongue space a bit better.
Right.
But yes, I think that sometimes it can definitely be worthwhile.
And it can be surprising. Like I have one and it was supposed to be a staged release, but it was wild just with her, she got just that release and it's like, oh my gosh, okay. No, we look amazing. I love what we got with just this. It wasn't as deep as we thought, but she got so much range of motion. Her swallow and sleep have improved so much. So, surprises. We still have surprises sometimes at the other side of a procedure. I wanted to know, when do you decide not to do a release? Like when you're talking to a family, how do you navigate that with them?
For an infant, or what age group are we talking here?
I would say like school aged. Let's talk about these older kiddos you're getting. Infants, I feel like there's a lot of conversation around it, but as we get a little older, that's when it can be kind of tricky.
When would I not do it?
Yeah. Are there times that you're like,
I want to know that there's adequate tongue space as well as adequate myofunctional therapy, but I want to know that I feel pretty confident that child is going to be able to sit through in the chair. Otherwise, I'd rather not do it. And just wait till they're a little bit older.
Yes.
Yeah.
And just, is there anything that you're like, I really want them to have this from like a tissue standpoint? Like I'm just thinking, for me, I like to see the inflammation go down a little bit if they're kind of in an inflamed state. Now, sometimes if they're just mouth breathing all the time, they're going to be inflamed. So it's this balance that we look for, but I wasn't sure if you had anything like that you recommend and try to get kind of calmed down.
Yeah, no, it's inflammation. No, not something that I've really looked at. What are the key things that you try to do to actually reduce inflammation?
When possible, we
Yeah.
increase kind of lymphatic support to make sure that they're actually draining, detoxifying a little bit, getting more movement. Sometimes these kiddos, they're so sort of sluggish as far as like, I mean, they're kind of hyperactive, but also not really engaging with whole body movement. So it's like, let's just see if we can get them pooping regularly, like, are they actually moving toxins through their body, hydrating, things like that. And often, if we have some neurodivergence and fixations, things like that, it can be tricky to balance that with them. But sometimes it's like we just want the body to not be so inflamed that they're hearing this noise just of like, whoa, now we've got one more thing on top of it. So it kind of depends on the cases. When possible, I love to work with like a dietitian, and sometimes we can get some inflammatory supports, just even turmeric. I don't make those recommendations, but I'll work with them and things like that. I just find sometimes that can really help.
Yeah, for sure. I actually feel that I have a lot to learn in that space as well. So I really do want to next year learning more. I don't know if you've seen recently, I posted a photo on my social media on a child I saw at 17 months, and now I'm starting expansion at 14 months. And it was like, I'd never seen it. People always say, the osteos or chiros always say, oh, we've released the palate is flattening. And I've never actually seen it. If I look at my photos, I've never seen it. But here I have a patient with the most gutter palate, and it actually had a bit of change in shape. So it went pretty viral. I think so many people caught that case. But one thing the mum said is she wanted to avoid ENT surgery. And she said she did this lymphatic drainage and facial massage. She looked online for it, and she found it really helpful for her child. So yeah, I think, wow, there's so much information out there to know that there could be other things that could really help optimize or get things moving in the right direction. So yes, it's an important question what you asked, but I'm yet to discover it all.
Well, I just have loved this conversation, and already I'm like, oh, I want you to talk to this person. So I'm going to connect you to a couple of other podcasts that I just think would be really fun for you to share with their audiences as well. Because it's just so important that we're breathing, that we're moving, that we're identifying these restrictions that are getting missed. So guys, this is Dr. Shereen Lim. Please go get her book. And where can they follow you? Where can they find you?
I'm the most active on Facebook, Dr. Shereen Lim, and also Instagram, Dr.Shereen Lim. But I have a new website called breathesleepthrivebook.com. And I would encourage people to check that out, and I'll keep building that one out.
Excellent. Well, thank you so much for your time. Yes. All right, everybody, you know the drill. Please like, share, follow, and subscribe to the podcast. It helps get it out to more families and providers who need this information. So thank you so much for your time. I hope you have enjoyed this episode of the Myohacker Podcast. Remember, small changes can make big impacts on our overall health and well-being. If you enjoyed this episode, please take a moment to rate and review wherever you get your podcasts. This way, more families will learn about this important information, and we can make a bigger impact. Head on over to myohackerslp.com for in-depth resources and guides. You can also join me on Instagram at myohackerslp for bonus content and demos. And if you have questions or topic suggestions for future episodes, send me a message. I would love to hear from you. Until next time, let's biohack myofunctional health as myohackers who change the world through intentional action and connection and breathing. Quick disclaimer reminder, the content shared in this podcast is for informational and entertainment purposes only.